All right, welcome everybody. As folks file in the virtual room and in person here, I want to welcome you to this seminar. Before I get started, it's a problem. Welcome. Nope, it's going to go back. Okay, I'm going to start again. Welcome, folks, to this seminar. I want to start by acknowledging where we are in the land. And this is an image from native land that shows this portion of Turtle Island. There we are on the north shore of Lake Ontario in Toronto, which I understand is a Mohawk word, Garonto, that the name of the city derives from. And what this image shows is, of course, the extraordinary diversity of First Peoples who have been in these lands for thousands and thousands of years. Here at U of T, we acknowledge in particular the Huron-Wendat, the Seneca, and the Mississaugas of the Credit as the peoples who have cared for these lands for thousands of years. And of course, today, Toronto is a very large and vibrant city and urban community for urban Indigenous communities. So we're very fortunate to share this land with these peoples. And for me, as somebody who directs a center around climate change, around planetary health and sustainability, the expertise, the practices of the First Peoples of the land are vital to the work of sustainability and a more livable future for us all that we are trying to find our way back to. Today, I'm really delighted to welcome my colleague, Dr. Sara Allin, who's an associate professor in the Institute of Health Policy Management and Evaluation within the School of Public Health here at UBC, and the director of the North American Observatory on Health Systems and Policies, which is a sister to the longstanding European Observatory on health systems and policies that does a lot of work at the subnational level. So Sara is, to me, it's just extraordinary as this work moves forward. It's so wonderful that scholars and scientists like Sara Allin, who have tremendous expertise in comparative health policy and health systems and health economics, are looking seriously, taking up very seriously the questions that arise as we try and address those issues with climate change in view, and it strengthens tremendously our capacity to understand and address these challenges. So today, Sara is going to talk to us about public health and collaborative governance in extreme heat response, evidence from Canadian provinces and urban centers. Pass it over.
Are you muted? Okay. Hi, thank you for the invitation to be here, and thanks for an opportunity to present this work. Some of it is finished and we're publishing, and some of it's underway. So we're really pleased to have this chance to discuss and to hear thoughts on this work. And I'll try to look in the right place. I keep looking up there. And it's a really complex technological arrangement here. So wonderful to be here. I'll just acknowledge to start the big team behind this work. It's been a major team project with many co-investigators, several trainees and staff members, and co-investigators, including Fiona beside me, and participants from community organizations like CREW, and many participants from across the 3 provinces that we've focused on, and community members as well in our 3rd project. So this wouldn't have been possible without funding from CIHR, as well as everyone's engagement and leadership and participation along the way. Several of the main team members are here in the physical and virtual room and will be keen to participate in the Q&A, I'm sure, as well. So to situate this talk, I'll just take you back to a few years ago, the Chief Public Health Officer report on mobilizing public health action on climate change in Canada was published. And among other things, the report spoke to the pressing need for coordinated action among all the actors and interested parties to address the challenges faced by extreme weather events. And, as the Chief Public Health Officer of Canada, Theresa Tam, at the time, she really drew attention to the way in which public health authorities could play a greater role and more effectively in partnership with many of these actors. And after this report was published, there was specific call for research on some of the research gaps that were flagged in this report. And so we put forward a proposal to address some of those gaps. And one of them specifically was around the governance arrangements that would support public health partnerships with other actors. And we aimed to focus at the city level, given cities are nested within provinces within the country. And it's at the city level where much of the leadership and the response to extreme weather events, as well as the assets and capacities, are located as well. So I'll present very brief overviews of 3 projects. 2 of them were funded through this call. And the third is on a recent work that is ongoing and really stemmed from and was motivated by the findings from this project. So project 1 is around collaborative or networked or partnership governance, dealing with extreme heat specifically. And we narrowed down to look at 3 cities. This was meant to be a 1-year project. It's a very small catalyst project, so we tried to scope it. It inevitably became much bigger and took much longer than we expected, but perhaps we should have focused on 1 city, but given my interest in comparative research, that would be impossible. So we had to pick 3 cities in 3 provinces. It was overly ambitious, but we're really pleased to be at the stage of wrapping it up after several years. But we had multiple aims, but we were really focusing on the governance mechanisms that were in place to support local heat responses specifically. And by governance, we take a broad definition of both formal and informal mechanisms and structures that shape the way different actors and participants set goals. How do they interact with each other? How
our
are
roles and responsibilities sort of outlined, and what are the features of those
structures and mechanisms that may facilitate more effective partnerships and more effective actions. And so we started with a scoping review, and this was really to see what else had been done in these 3 provinces, because we know that there's a lot of scholarship within Canada on climate change broadly, on extreme heat specifically, and we were trying to see the sort of what has been studied about the role of public health authorities and partnerships with other actors. And then we spent quite a long time doing more in-depth case studies of 3 heat response plans in 3 cities with interviews with multiple stakeholders. So before I get into the results, I'll give you a bit of conceptual framing that was really informative for this work. We took a very broad approach to looking at the literature that has also sort of been, focused on understanding the ways in which different governance arrangements may be supportive or enabling multiple actors to work together in a collaborated way. And this is particularly relevant in a federation where there's going to be multiple governments involved, as well as in complex policy issues like climate action, where there's necessarily multiple sectors, actors, and different levels working together. And so these literatures are really helpful to try and understand sort of what do we expect might be ways of sort of organizing, or ways of understanding how collaborative arrangements might work, and what are the factors that might shape the effectiveness of those partnerships. So we look to these literatures generally to sort of see how decision-making works in complex and federated models like multi-level governance arrangements. We look to the network governance literature to see how there are different approaches that can be taken with sort of more decentralized governance models versus more hierarchical ones. And then also the literature around what might affect the effectiveness of these arrangements. And so here it comes down to things like transparency and accountability, policy capacity, et cetera. So these really informed the way we approached the case studies specifically. And the scoping review, we hope to be able to share a published article soon, but it's still under peer review. What we found is that there's been limited scholarly attention within these 3 provinces on the sort of collaborative action for extreme heat. And what we tried to do was sort of characterize by looking at the scholarly literature, but supplementing that with a wide range. And you can see the number of sources was quite large for gray literature in terms of websites, reports, documents that were helpful in trying to understand what the role of public health authorities were locally and provincially in heat response, and then how these actors generally work in partnership with other actors. So we tried to characterize those. Generally, here are some high-level findings from the work. Is the focus within public health authorities tend to be on the sort of downstream activities, being involved in the heat alert systems and providing health information, and less on the sort of preventive or upstream partnerships needed to prepare for and to mitigate the potential inequitable health and overall health effects of extreme heat. And generally, through this literature, we found that there's an advisory role primarily by public health actors and sometimes a co-leadership with heat response specifically. So this helped to set up the study, but also helped us to select our specific cases for more in-depth investigation. And what we found, so we ended up selecting 3 specific heat response plans in the 3 cities, Toronto, Montreal, and Vancouver. Comparable in some ways in terms of being, large urban centers, but experiencing different climate risks and events and with different histories of, and experiences with major events that have shaped their heat response plans. The heat dome, for example, in BC being a major trigger for refined and reformed heat response plans in that province. But here we've just put the screenshots of the 3 specific plans we focused on, and I'll walk you through a few findings from our in-depth case studies, starting with the governance mechanisms that were really related to the assigning of roles and responsibilities and how these were perceived among the key stakeholders involved. And so generally, we see that there are clear leadership sort of assigned among the members, where these, a lead actor would have their assigned role, and there'd be a sort of a description of what other actors were involved. Interestingly, Montreal kind of stands out within these 3 cities as a bit of an outlier throughout the findings. So I highlight a few of these instances here where in Montreal, unlike in the Vancouver and Toronto cases, the public health authority itself took a co-leadership role with the emergency response function of the city of Montreal. And in Toronto and Vancouver, it's really the city and their emergency response department within the city itself that was assigned the lead role, with public health being more advisory. And so what this was seen to be doing by stakeholders who we spoke to was permitting perhaps or facilitating more of a population health lens in the overarching response plan, with an aim to shift a bit more to prevention, to preparedness than simply response, which is very important as well, but trying to take a more holistic view. These heat response plans are also articulating the role of various sectors. And what was noted in a sort of standout in the results was this public-facing plan in Toronto which was seen to improve a bit of the sort of transparency in terms of who's involved, naming individuals, naming sectors, which allows some public accountability then for their participation in these roles. And we also found there was, generally across the case, a very clear role for each sector to kind of leverage their own expertise and their own capacities. And, in Vancouver, this was described by some stakeholders as being quite siloed in terms of the key actors having their own defined role that weren't necessarily aware of and working closely with the other actors. But this was also seen to be a bit of a strength where they weren't overstretched, working beyond their existing capacities, for example. We also found some sort of structures and features of governance mechanisms that were supporting collaboration with the province and sort of vertical collaboration between the local actors and the provincial actors. For example, all provinces have a sort of provincial heat alert systems, and these then trigger the local responses. There was greater evidence of sort of vertical collaboration between provincial and local actors in BC and in Quebec, with regional coordination centers and a BC Heat Committee, and this wasn't evident in Ontario. And locally, we identified several mechanisms for the sort of horizontal collaboration across local actors, with many committees and several coordinating calls and check-ins. In Vancouver and Montreal, they stood out as having a more regular kind of approach to check-ins throughout the season. In Toronto, these were only pre and post sort of response plans, sort of pre and post the summer. And in Vancouver and Montreal, it's really seen to be much more regular, which permits more adaptive approaches and responsiveness to how things are going. This slide, we're not going to spend a lot of time, but we can take questions, but it took a long time for the team to produce organographs for each of the cities' networked arrangements to heat response. And because we don't have a lot of time, I'll just emphasize a few features that kind of stand out. But generally, we see there's evidence of, multiple actors with the need for clear mechanisms to support the actions across multiple actions at local and provincial level, speaking to the need for the sort of polycentric and multi-level governance arrangements. The complexity of the network seems to be much greater in Montreal, as evidenced by the number of actors involved, but also the different the role of the coordinating functions, which is kind of a single line represented in Toronto and Vancouver to show that there's a more simple kind of governance arrangement with coordination. And in Montreal, they're trying to more formally engage in the coordination tables, multiple actors. So this just gives you a visualization of some of the findings that we've been already presenting. And we think that this provides a useful kind of snapshot to then uncover, like, who are the key actors, how are they supported or not? And we don't really know, like, is there one that works better or not? Because in each, they're going to be responsive to the, patterns in relationships that have predated the response plans themselves and will evolve over time. But they, each can be kind of examined more closely to see how they deal with the particular challenges that they face in relationship, in collaboration across these actors. So importantly, we also heard a lot about the informal networks and informal mechanisms that support collaboration across these actors. And, these came out in many of the interviews across the 3 sites. And, there were a lot of examples, including pilot projects and research projects that we've included 2 logos from 2 projects that were in Montreal. as being sort of referenced as a kind of separate complementary work going on that is supporting the heat response, even if not formally funded by or accountable to the same degree. And then we also heard that these more informal networks were really helpful in terms of keeping people engaged and building trust among the actors. We heard a lot of challenges about, the existing mechanisms to support collaboration. This included the limited capacity for evaluation and just little evidence of evaluation of these plans themselves. There's many reasons for this. One of them was that there was this lack of kind of agreement on what performance metrics can be used to then attribute to the actions that they're taking within the heat response, because many of the activities are, really hard to isolate amongst other public programs, like the use of libraries in cooling centers and the potential reduction in hospitalizations from heat. Like, how do we draw a causal relationship between these two things, for example? And also the challenge of going beyond like single organization or entities' own performance monitoring and measurement requirements versus the collective action of all of these actors, which none of the 3 cities we focused on had an approach to dealing with that challenge, and primarily focuses on each actor sort of monitoring themselves. And then capacity is a big theme. This is not going to be a surprise to anyone, where there's just limited funding, time, limited human resources. There's offloading of some responsibilities from some groups to others. And there's one of the major themes that came up, this capacity sort of cuts across all these other themes, with capacity for evaluation and limited data, as well as capacity for more upstream action and community engagement, which were also seen as challenges. For example, with regard to community engagement, there were variations in how this was approached across the key actors involved in heat response plans in the 3 cities. Vancouver has frequent engagement with community stakeholders to inform heat responses, and there's sort of pilot programs that they've funded. And similarly in Montreal, there are collaborations with community organizations as well. In Toronto, there was less kind of formal engagement within the heat response itself. And across all 3, a recognition that this is an area where there's kind of a disconnect between many of the activities involved in community organizations supporting communities during heat events and the actions of these heat response plans specifically. And this came out so much and so clearly that we decided to follow this thread and build on this work from the lens of community. And that brings us to the next project, which we will briefly share some of where we're at there. And this project was also supported by a CIHR grant that was actually targeting and featuring, the aim of the grant was to support community partnered research. And so it just happened at a good time where we were really trying to follow that thread in our research, that we've been speaking to all the actors in government and public health and other key stakeholders in emergency response, et cetera, but had only a few kind of interviews and materials from community organizations themselves. So from what we learned from Project 1, we realized that we needed to narrow our scope to 1 city. So, and community partnered work is, requires this time and focus on a particular community. And so we worked together with CREW. I don't know if folks are aware of this wonderful community organization in Toronto that has been working in this space for supporting strengthening resilience to extreme weather at a community level. And they were really keen to support us in this project. So we worked with them to apply for funding. And when we were successful, we started a long series of sort of community meetings, building rapport, sharing learning, and with crew and volunteers from the community of St. Jamestown in Toronto. So we were really hoping to try and understand from the view of communities themselves how we can overcome some of these barriers and challenges to more equitable heat responses in the city of Toronto. And we were really excited to have a major community event just a few weeks ago. So this is super fresh. But the team has already started visualizing some of our findings from this community engagement event that had almost 50 people from St. Jamestown, from the very young who needed childminding to the very old who needed caregiving support. And members of several high-rise Toronto housing units in St. Jamestown participated at a local church, and we had a great engaging session where we focused on just a few questions to keep it super broad. And these results show us the results of the discussion. We had many tables and then synthesized across what makes it hard to stay safe during heat waves, and bucketing these by, issues with the housing, issues with health effects, safe spaces in the neighborhood, and then social, financial, and communication issues. And then on the flip side of that, we asked and had brainstorming sessions around what helps stay well. And again, we sort of grouped these into buckets around, which you can see on the slide. These then informed the development of priorities and strategies, which we've categorized as staying cool and safe, staying connected, staying informed, and staying prepared. And within each of these buckets, we've identified some key actions that we're starting to break out by actor. So city government, city officials can, play a key role, and then we articulate what that role is for each of these specific actions. Community groups can, involve residents in participation and in communication channels with the city, et cetera. And then there's also landlords and what can they do. So we're at the stage of synthesizing the results from the engagement session. We're meeting again with our community partners and other actors like Red Cross and City again next week to review what our findings are and situate them within the evolving and revised Toronto heat response plan. And to, we're going to try and triangulate across the different perspectives that we're hearing. But this is very much work in progress. So I will move to a concluding slide and then looking forward to some discussion. The conclusions are more from the first project because that is where we have some conclusions, but we've identified some key features of, the effective, what are the factors that might support more effective collaboration? And we've identified some key strengths, in particular the, co-leadership model in Montreal and the approach to kind of make sense of the complexity a bit more explicitly, or taking account of the complexity a bit more explicitly in the heat response plan, kind of stands out as a potential model for other cities that may miss a lot of the, miss some opportunities to adequately engage across all these different actors involved in heat response. But we have many next steps. We're going to try and publish some of our results from Project 1, and we're going to share a community engagement report with the members of St. Jamestown and with crew. And we're going to be doing a few more interviews with City of Toronto folks and try and refine some of these recommendations that can be really useful, informed by all the different phases of research, and importantly, centering the community voices in those as well. I think that's it. And I will just end with a promotional slide for the NAO. We don't have a lot on this project yet. We will have our published papers shared on this website when they're available. And we're happy to be connected with anyone who's interested in learning more, and we can have other engagement after this, during this session and beyond. So please don't hesitate to reach out.
And stop sharing. Wonderful. Thank you so much, Sarah, for a great talk. Those of us in the room can clap. Starting comments in the chat, questions in the chat, there will be questions in the room. I am going to take the privilege of the chair to ask the first question, if I may, and then I just get to, and then open it up to a wider set of Q&A in the room and online. I want to ask you, Sarah, about the capacity of city governments and how much that comes across in this. So you had a very clear focus. It was an extreme heat response. It's a very specific set of activities. But as you say, with your community engagement and more broadly in the science, we know that the way of addressing this is not only that momentary response, but all these other kind of deeper issues of the physical and social infrastructures and economies and such. Did you see within those city networks connections to other aspects of so were the parks people at those tables and the building code people and anybody else who's working on sort of just a livable environment and opposing gentrification or any of those other kinds of things that city governments tend to do? Or are these networks just totally focused on that one action and not interconnected to, so ultimately have networks and networks of networks to address this response? How much of those wider networks are sort of present within the response networks?
Yeah,
that makes sense.
I think, Fiona, you've touched on one of the major limitations of the response plans that we uncovered through the work, where we know that these are very narrow in terms of, there's a lead, there's a branch, and then they try and coordinate their network for extreme heat response specifically. And they are limited. There's only a few people, and then they have limited resources. And then there's all the other parts of the city and with all their portfolios. And those were quite disconnected. And maybe I'm a bit biased in terms of like the Toronto experience being closest to me because of where we sit. But there's certainly huge gaps in terms of the potential for more upstream or more engagement and communication of like how we're dealing with extreme heat and all of the other actions that cities do to try and prevent the major health effects of heat because of the way we're greening neighborhoods, because of the way we're adjusting for, in transit and helping to mitigate these health effects through the other city effects and through investing in parks and so on. So mostly it's a mini network operating within a very poorly networked group. And within at least the city of Toronto, there was recognition that they, don't communicate enough with, and we're even trying to do an inventory within the city of Toronto of like, who else should we be connected with? So very like early stages of what you'd think would be quite an advanced structure, and at least advanced in terms of knowledge and awareness, that was a little bit surprising as being a major gap. So it's a bit of a microcosm. I think it reflects a major capacity and, broader challenge of overcoming the kind of, siloing across city government branches. There is the recognition of it was there though, and I think at least in Montreal there was some emphasis, maybe perhaps because of the public health co-leadership model that was really interested in prevention as an orientation, like how do we prevent some of these health effects and inequitable effects. But more so in a like most in this and less in visible action to date. But it's kind of a sad answer to the question.
I'm going to ask a question in the chat, and I'm going to come to you, Bart, but I'm going to follow up by saying that I actually think the Salas are also across the research community because, as you said, you're working on a catalog of who. We are also working with an arm of the City of Toronto on a catalog. So we all need to do a better job as researchers, and there's multiples of us across just U of T, never mind York and TMU and OPAD and all sorts of others, colleges and universities and other research groups that are doing work. So the challenge is multiple. So the question I want to ask from the chat is about the role of Environment and Climate Change Canada in any of this. They're asking about, in particular, the Meteorological Service of Canada. You mentioned provincial and municipal roles. So there's a kind of a specific question here about the Meteorological Service, but perhaps there's a reference also to the federal governments and that kind of multi-level in the sense of federal, provincial, municipal dynamics that you saw.
Yeah, that's a great question. So our organographs, which we couldn't see, they're too small, include the federal government because there's a key role there, which is the detection and triggering of the heat alerts. So we this came out in all our cases as being important. This is slightly different in Montreal. Federal government and the Environment and Climate Change Canada is the trigger for the provinces, but in Quebec, in our asymmetric federation, this is not surprising, but it's only one input that then is locally contested. Decided. It's like, will we follow the federal government is then decided, whereas in the other provinces, it's not a decision, it's followed. And so that was the only area of sort of multi-level federal to provincial to local involvement that came up in any of our documents or interviews, except for perhaps the funding of there was some federal targeted funding of public health programs and needs assessments and some of those sort of research pilot funding projects, but these were quite separate.
Yeah, it's like the vulnerability and capacity assessments for climate adaptation.
Yes, that one. So thanks for that question.
Dr. Bart Harvey.
Well, I'll state the obvious. Once you've studied 3 big cities in Canada, you know something about 3 big cities in Canada. So I work with the Public Health Department in Hamilton. We have an exact opposite scenario. So the Public Health Department is the lead agency for our heat response. And there's a multi-partnered group that's been in place for several years now that includes forestry, that includes recreation, that includes housing within the city. And then if anybody knows Acorn, who's a kind of group that's an advocate for apartment dwellers, they're on the group and it kind of gets looked at. It's sort of nobody's in charge, everybody's in charge. So if you have a little extra bandwidth, I'm more than happy to connect you with my colleagues in Hamilton if you want to see how well, we're over 500,000, so we're not really tiny, but compared to the megalith, the now 6 cities in one for how long's that been now? 35 years? Too long. Yeah. So yeah, it can be done differently. I know how it's done in Hamilton, but like Ottawa would be an interesting question in Ontario. But there again, once you know one city, you know one city. Don't generalize.
I feel that very clearly in our, this idea of using these 3 urban centers as somehow illustrative of a Canadian phenomenon. It's not the case, and I appreciate you bringing this example as a nice counter example also to the Toronto case in terms of how interconnected the actors are. We would need a new grant, but we would be really delighted to partner with you to learn more about it and to see how we can then start to build some of the lessons across these diverse cases, because each is going to have their unique features and their unique arrangements and leadership models, but then also they will face some similar challenges and have addressed them in different ways that I think will be really valuable for cross-jurisdictional learning.
I'll check with the folks that are closer to the ground than I ever want to be. Because I think there are some reports that describe kind of what's been going on. More than happy to send them your way.
So we have another question here about explaining the definition of upstream versus downstream and what parts of preparation or heat impact are upstream in your definition. What organizations, what parts of heat risk are downstream, what organizations' roles and responsibilities, how. So not a small,
Great question.
not a large or small question.
I appreciate the question, and yeah, these terms are used very differently in different contexts. And here we are, I guess, focusing on the heat response as being the downstream in terms of facing and dealing with the immediate needs during an extreme heat event, which is the triggering of the event, the public health response, the opening of cooling centers, the presentations in the hospitals and other places that may hopefully be more avoidable, and then the use of emergency services and so on. That being downstream and reactive and responsive versus more upstream prevention that we were starting to talk about with greening of cities, with supporting communities in advance of any kind of extreme weather event in terms of, who do you turn to, where are your supports, and the prevention side. So that's kind of how we're distinguishing it, and it involves some of the same organizations, but also some different ones. So it depends on what they're doing at the time, I guess, but we're sort of categorizing it that way, the sort of immediate response function versus preparing for, but also trying to prevent and mitigate some of those negative effects as being more upstream.
Any other questions in the room? I mean, can I ask? Oh, sorry, Chris.
No, that's okay. Do you want to go ahead and then you never know, you might cover what I'm thinking. All right. Yeah. Who knows?
Knowing Fiona, she'd rather you cover it.
Oh, anyway, so first of all, out of pure ignorance, is there an overarching mission or vision of what these reports are meant to focus on? Like, what is it? And is that unified? Like, does everybody think of this in the same way when creating the plan?
So nothing is unified or set. So each
that was my sense, but I was like, I know nothing. So
plan. Each
yes,
have devised the plan according to their own,
But is it like prevention of loss of life? Like, is that fundamentally what this is all about, or is it just what we think is important? Or
I think each plan has their own stated objectives, and then they fit within the provincial broader plan. So in Ontario, for example, there's a broad plan that then assigns, public health standards around how they have to have a role in prevention of health effects of heat and so on. But I don't know, Mel, you seem to have a point.
Yeah, I think just kind of what you were saying around each plan definitely has a focus on preventing heat health impacts, which are broadly, morbidity, mortality, but there's no specific, metrics for how, the thresholds of how those impacts would be prevented. And I think that kind of ties into the lack of strategic evaluation that's built into these, or not built into these. I always
find it's like start at the end and work backwards. Mm-hmm. So what is it we're trying to
exactly.
Is that minimize loss of life? Is it because, and sorry.
I was just going to add, I think a secondary or maybe just as important goal, a secondary goal that's been mentioned by at least like the emergency management within each city is just continuity of services as well within the cities. So
all services or healthcare?
Or city services, right? So that's going to be like emergency response because those are overburdened during heat waves.
Yeah.
Public spaces, and also there can be like water and power outages during extreme heat.
Yeah.
So things like that are also a major priority.
Interesting.
Yeah.
Thank
Oh,
you.
and Stephanie, our colleague who online mentioned to me, she's saying, sorry, it's not posted probably. She shared with me, thanks, Stephanie. Across all plans, you can also look for some common objectives. And one of the common objectives across the local plans is to mitigate heat health impacts, particularly among at-risk populations. So there's an equity lens, sometimes it's broad, but that's a component across all.
No, that's really helpful. The reason I'm asking is because I'm thinking about the end, or the goal.
No.
Not the end, not that one. The goal. Because to Ilana's point about that disconnectedness and the silos, not which of course we see all the time in so many different things. But it's in terms of, okay, we know we have limited funds. How do we prioritize who needs to be at the table? Who are the interest holders, constituents that we need to bring together? And so the example in Hamilton is really fascinating. And I feel like what you've uncovered with this work, which is so helpful, is the fact that it is so variable. You know, the approaches, and I'm like, well, is there not one unifying goal? And then so what will get us there? And it feels like there isn't yet. And I just wanted to check if I'd missed something in all of that, because I'm also doing work with Public Health Ontario. And it's fascinating to me the variability in how they approach everything, really, which I was unaware of, and ultimately seems kind of unhelpful in addressing public health issues in a way that's where they can learn from each other, kind of, and come together. Okay.
So ultimately, all of these are going to fall under the auspices of a municipality,
Yeah.
which by definition is political. So who are the people at the table?
Yeah.
I mean,
And who needs to be?
I've been in Hamilton long enough. We've had 3 city councils. They're all different.
Yeah.
We're going to get a 4th one this October.
I feel
So
like we're at the
it's-
mercy of that political cycle every time.
Yes, one of my senior colleagues many years ago taught me, you know, Bart, they call it public health for a reason. It's public. So yeah, it's not, there's no calculus. If you like calculus, you have to go to the mathematics department. You won't find it in this building.
So we've got 2 questions. One that's written, and then we've got Juliana's got her hand up, and maybe we'll go to the written question, which is sorry, is there another one that I'm missing?
That's it.
So we've got this question. We've got a bunch of questions actually. Okay, sorry. But a question about the World Cup is coming up. What are we going to do? Like that is sort of, I mean, you're looking at governance structures, which is not a sort of the 5 things we need to do this summer.
Yeah.
So maybe you want to wave that question off, but maybe you don't. Maybe you've seen in the governance structures.
Emergency Management Ontario already has a plan. I've already seen it presented. They're ready and waiting.
Good. Okay, so that's your response. Do you have a further response?
Well, I also see
I mean, there's a better one.
Okay.
that their heat response after the heat dome was completely revamped, and so this, more proactive approach could be taken, obviously. Yeah.
I think Toronto's plan is also being updated currently.
Yeah.
They're revising their.
I mean, the reality is
strategy.
they're, as you sort of said at one point, they're different contexts, they're different capacities, they're different structures, and there's an evolving challenge that actually nobody has a full handle on, right? This is not, we haven't at all, we didn't even talk about wildfire smoke. So that's like public health doesn't quite know what to do or say entirely with the limbo. So I wouldn't expect a rigid, formalized cookie cutter. Anyways,
And every year it's getting worse.
and everywhere it's getting worse.
Yeah, yeah, yeah.
Exactly. Juliana, you can unmute yourself and ask your question if you'd like.
Hi, I'm Julie, and I'm one of the Emerge physicians at
You might
UHN and
have
St.
that
Mike's.
capacity.
Can you
Yes.
hear me?
Yes, I'm trying. We.
Can you guys hear me okay?
Sorry, could you repeat that? We
Can
didn't
you
have.
hear me okay?
Yes.
Okay. I'm one of the emergency physicians at UHN and St. Mike's. And one of my questions is just whether or not you're aware of collaborations between Toronto Public Health and the hospitals in terms of sending out early warning systems to patients. Like I know there's some pilot projects in the US where patients that have specific diagnoses like asthma, COPD, heart disease, who are at risk of medically decompensating during extreme weather events, they get a text message saying, this is the air quality, this is the advice from public health, and here are your local resources. To my knowledge, I don't think anything like this exists in Toronto. From the emergency physician perspective, giving advice on where to access resources is so fragmented. It's so up to the individual practitioner to be aware of what these resources are and where patients can find them, if that's like anything citywide that you're aware is happening across Canada.
Thanks, Juliana. I think what your observation is consistent with what we found in Toronto as well. And so what's different in other provinces is the role of regional health authorities as a place to facilitate some of the connections between, for example, the public health role during a heat response and the role of the hospitals. So that is not the case in Ontario's system, where hospitals are independent, public health authorities are independent. But in Montreal, for example, there was this more routine engagement within the healthcare system actors and dealing with emergencies in a more coordinated fashion, just simply enabled by that structural difference in the health system. So in the Ontario context, pilot projects are going to be the main mechanism to enable those types of collaborations. But I think there's,
Do you know, I think there's also some work being done in the OHTs. I don't know, because we had
and again, it's very local. So there will be varying involvement of public health authorities in OHTs, and where there has been some so they're again local, but
OHT standing for Ontario Health Teams, for anyone that doesn't know. The Joy's back.
All right, Juliana?
Just a follow-up question, like who at public health can I connect with to try to work on developing a project like that?
Can I respond before Sara does, just to say, please join our meeting tomorrow. We have a number of health leaders who are convening around a TASN strategy, Toronto Academic Health Science Network, precisely because of this challenge. So we've had a table for TASN around climate and health for 6 years now, and there has been interest, but not movement entirely on the adaptation side. But now we have some brilliant clinicians and others who are trying to pull together a heat response with training. And so it would be wonderful to connect with you. So that may not be the only way forward, but that would be one way forward that could be helpful, Juliana, would be to connect with you and with that network that is working around this. Because you're, as Sara said, these differences across provinces, which you didn't have the time to get into, it's one of those fundamental issues in Ontario, is this disjuncture between public health and healthcare.
Yeah.
All parts of healthcare. We saw it in COVID in spades.
Yeah. But Juliana, if you wanted to, we could stick an email in. Okay, great.
Yeah, and in this meeting, there are folks who you can connect with. For example, from Toronto Public Health, Howard Shapiro. Thanks for pointing out the app from Environment and Climate Change Canada. So you guys can connect with each other, right? Perfect.
I was hoping Howard was part of this meeting.
Yeah. Howard may have thoughts in response, even.
Let's put him on the spot.
So Howard, over to you. How do we prepare for the world? Yeah. Bart says they've got to figure it out.
Go to the cottage.
I have a question. The question I was going to ask was about informal. Oh, I'm sorry. Howard's going to answer. Good.
I guess there's different questions there. I'm not sure which one to answer.
Take your pick.
Although
Howard.
I'd be very interested in the TASN meeting. So I don't know. We can connect later.
Absolutely.
So yeah, in terms of the alerts, like we're just taking the information that's being produced by Environment and Climate Change Canada, and those are health-based, and we're using them as a basis for our action or encouraging other people to do that. So we had been in the business in Toronto in the past of actually issuing our own alerts with a specialized model using forecast data from Environment and Climate Change Canada, but that was very difficult and hard to do. And we had, we weren't experts in meteorology. So it was, we always felt at a disadvantage and publish these forecasts and pushing them out. So we've really moved to using Environment and Climate Change Canada, who's developed their warnings based on health inputs, and it was done in collaboration with Public Health Ontario. So I think that is like great in terms of thresholds and getting warnings. And then it's a lot of it has to do with implementation in the different organizations about how they take that information and use it to help protect people's health. I can't remember what the other thing was about FIFA. Was that the question?
World Cup.
Sorry?
Preparing for the World Cup. What should folks do?
Oh, well, I'm not sure what that question means. I don't think you necessarily need to do anything that different.
I guess it's just the large crowds and that sort of risk that occurs, I suppose.
Yeah, and there's definitely work that we're doing and work that FIFA itself is doing for the people that are going to the stadium or they're going to Fan Fest, whatever, to prepare for if there's extreme heat event or if there's an air quality event. Looking at, for example, Toronto has a network of places that are air conditioned called the Heat Relief Network. And so we're looking to see if we can expand it to include places that are close to where the FIFA events are. But I think FIFA itself may be also looking at things within the where the events are happening to provide for the people that are actually, buying tickets and going to their events. So that's it in a bit of a nutshell. There was one point, now I've got the microphone, is that the heat response is really just about in the moment, trying to mitigate the impacts of the heat event, for that few days in season or, it's very seasonal. And some of the things that are about prevention, I think, are much longer term and fall into the basket of climate change. And then that's a different set of people that are working on it. And there definitely is a disconnect between some of that stuff. But really, the heat response is almost like an emergency response in year. And that's different from some of the other things that can probably have a bigger impact, like the work that Toronto's doing on a bylaw for indoor temperature, for example. Okay, I'm done.
Okay, wonderful. That was super helpful. We have another, I think this might be a last question.
Oh,
Over to you.
I don't know if I'm gonna ask it now.
Yeah.
Hi, I'm Gabrielle. I'm a MA student. I was curious about your sense of the stability of these governance networks, kind of in the sense of if you were to come back in 5 years, would you find that the network is still kind of largely held together? It kind of has like an infrastructural groundedness, or would you find that it's flexible, either in the good sense of allowing new collaborations and connections, or flexible in the sense of liable to fall apart at, say, a change in budget or funding?
Yeah, it's a good question. They seem relatively stable with periods of revision following major events. So you'd expect that if there's like a major event that is, like the heat dome, then that might trigger a revision. Or if there's a change, you mentioned budget, like this could have a big impact. Overall, though, they're fairly stable over time, and without any sort of formal evaluation, then there's also less sort of outward pressure to change it. But that's, barring any major catastrophe.
Well, clearly many more questions to ask and answer, but this has been a really, really productive and interesting discussion. I want to thank Sara so much and the team for the amazing. We have many more fascinating events to engage you all, and take care.